My name's Cameron Holloway, and I just want to say a huge congratulations on getting through the written and the clinical exams. And I want to run you through some questions that I've asked in the AT interviews before on the basis that I think a lot of people are very underprepared when they actually come along. And so preparation is absolute key. Firstly, before you even start to think about the interviews, you have to think about the network where you're applying to. And I put network in bold in all of these lines here because most people on the interview panel are from various aspects of the network, not a particular hospital. You're applying to a group of hospitals, so that's what your interview has to be based on, because the people who are giving you individual scores are coming from peripheral centres, and you need to acknowledge their contribution to your training going forward. So find out what the network involves. Speak to people. Speak to the AT. Ask them about what their role is, what the advantages and disadvantages are, what the hospital actually does, and more importantly, ask them what interview questions they had when they came along for the interview. Then I would recommend that you actually email key members of the network. I think it's very frowned upon to give them a call because they're busy clinical people, and they may not want to take your call about your career when they're busy in theirs. But just let them know in the email that you're very interested and very keen to meet the team and would love the opportunity, and CVs attached. At the same time, you email and talk to people, ask them about opportunities. So as you'll know, a lot of specialties are very competitive to get into. And so I know in cardiology, most of the trainees don't come from from BPT in New South Wales. They've done something else. So what are the opportunities at the hospital if you weren't successful because of your interest in research and clinical, to see what pathways exist? One of the big things to do before you actually get there is practice with other people. Go through the questions that other ATs have been asked, and also the questions that are in here, to have a think about how you'd answer the questions. One of the most common questions that you're asked to start with is, tell us about you, tell us about your background, tell us about your training experience to date. And often people will say, look, we've read your CV, now we want to know about you and what pathway you've had to come towards the interview. I think there's two ways that I'd like to give you two examples of what I've seen in the past. So the first example is the person who says, I grew up in Sydney, I went to a top school, I got a top result at the year 12, I then went to medical school, got in the top 10 of medical school, graduated and did a master's in ethics, and here I am today, interested in respiratory medicine. Another scenario is to be real, because they actually want to know about you. What they're really after is employing people that they want to work with, employing people that are interesting, motivated, and successful. So, for instance, I grew up on the family farm, and I was very heavily involved with the farm right from the beginning, which actually is part of the reason that I've become very dexterous and interested in why I want to do respiratory medicine, because of the interventional side of it. Because I've always been very gifted with my hands on the farm doing these particular things. And then at university, I was really proud of the tutoring courses that I ran to gain money, and that was a big part of my teaching, which is another reason for why I've got a lot of teaching skills on my CV. Similarly, at university, I was really pleased to get involved with a lot of research, and as you can see on my CV, I've got some background in research because I was heavily motivated by Professor X, who did this wonderful work, and that actually motivated me to be interested in this specialty. So I've come to you today as a background in motivated by my family's work ethic, but also with the teaching and the research that I've had in the past. So it kind of gives you something different than the other people coming along, rather than trying to rehash your CV in a real way. And you can talk about successes, tragedies. What they're really trying to work out is whether you're motivated, whether you've shown success in the past, and what you see as important in your background rather than necessarily the academic achievements which have led you to be here today. And something really genuine, and try and link it in to why you're actually there. What is your real motivation based on your background? The idea about the specialty that you're applying to will clearly come up. Why are you interested in this specialty? What are your areas of interest within the specialty? And then how you see the roles of research and teaching, and what are the pros and cons of a career. I think you have to be really genuine. What's motivated you? Is it the content of the specialty? Is it the fact that it has acute and chronic components? Is it the fact that it has interventional components? Is it the fact that you can combine your love of teaching or research with it? Or do you see a particular need in society which has motivated you towards it? Areas of all specialties are going to be very different, and I think you have to have some form of idea about what you want to do in your future. You need to show some motivation in coming in here and give people a little bit of an insight, or a little bit of an idea of where you want to change the field, where you want to be motivated, how you want to reach out and contribute to the group in this particular area. The pros and cons of the career, I think, are really important to outline. It just shows that you've thought about a career in the area. And I think a lot of people really honestly bring out the pros and the cons. So, for instance, in cardiology, people often say, well, the specialty involves long hours, after hours work and very acute patients at times. Rather than just say the negatives, I think you can bring that back into a positive. So, for instance, the hard work, but you've been used to hard work in the area where you grew up, needing to work and do school at the same time, needing to be able to accomplish the violin as well as doing medical school. And so it just shows that you're not it's not a difficulty going into this field because of the negatives. Similarly, what are the pros? You would love to be able to see acute patients and chronic patients. You'd love to be able to do research on the side in this area, which this area facilitates. You'd love to be able to contribute to AI, which is one of your interests in research with this specialty, because you can see where that's going to. So really genuinely think about 3 or 4 pros and cons. And similarly, how do you see the roles of research and teaching fitting in with your clinical work? Not many people just come along wanting to do the clinical work. So have a think about any areas of research that you'd like to do, and also teaching, and have some type of motivation about where you'd like to fit that into your training and teaching. And you can think about other people who have been inspiring to you, such as academic researchers who've been able to contribute from the lab-based work to the clinical work, or make a difference in clinical care. And similarly, teachers who have motivated you in the past whilst they've done clinical work. I think it's really important to have an idea about where your career is going. Often the career trajectory questions allowing you to show that you have an understanding that this is a marathon, that you don't finish 3 years of AT and then become a consultant. They're really after your knowledge about fields of research and teaching that you can go into, and also about how you can gain clinical experience. And the fact that in 5 years from now, you're still going to be part of your pathway. And they're wanting to also see at the 10-year mark where you think you'll be in terms of changing some aspects of this particular specialty. In terms of you can see yourself doing respiratory medicine, going on and doing transplant medicine, potentially doing a PhD in transplant medicine in this particular area, to be able to bring the skill set back to this area, or create a new skill set in another area, for instance. I think it's good that people say, that they're unsure about where they want to be, but at the same time you also need to have some motivation. So coming along and saying that you're going to go through cardiology and see if you like intervention versus imaging versus EP is a reasonable thing in your head, but I think you have to have some type of motivation to be able to say that you're particularly interested in one area that's going to allow you to fulfill this in your career and also in the general community. I think if you get a question about independence and work ethic, such as how do you manage competing demands of a busy emergency department with an equally busy medical department, or if you're due to go home and there's a sick patient, what do you do? They're really asking, are you going to take over here? Consultants are often incredibly busy, can't come at the last minute, and do rely on the ATs to do a bulk amount of work with patient care in the hospital. And so what the question is are you going to be motivated, senior enough, knowledgeable enough, and be able to work as a leader to be able to be independent? And are you going to take over? And so I think competing demands in a busy emergency department with a medical department is just outlining how you're going to manage the team. And it interests me actually with this second question, how many people say about handover. I think what they're after you to say is that you're there to do the work and you're going to stay there to manage the sick patient, and this is how you're going to manage the sick patient, and this is how you're going to take it on. Frequently you'll be asked about conflict, and I think you have to have real scenarios. People know when you're mentioning a real scenario when you actually are able to give some detail. So mention names, mention locations, mention details about what happened in the scenario that you're involved with, how you witnessed it, and essentially showing your teamwork and leadership in how you manage the situation. There's a great example of a scenario that we've given for many years, saying that you've requested some intravenous digoxin, and the nurse doesn't want to give it on this particular ward without monitoring. What do you do? And how you're going to negotiate with the nurse. And a lot of good answers are, well, I think the nurse is actually correct. Given the bioavailability of digoxin is very good, I'll probably give it orally, as she suggested. Then feedback afterwards as to how it's gone. So de-escalating conflict, I think, is a great way of doing things and just being modest. But conflict is something that you have to think about how you've led these scenarios in the past, both with patients and with staff. Please think about research in the area that you've chosen. There will be likely some academics in the group, and so have a think about, have you been involved with any research to date? What research would you consider doing? And then about other research that's been published already. Now, you don't have to have an extensive research background, but you can say what research motivates you, what research you're really interested in at the moment, and the research that you'd like to be motivated based on what's going on in the literature. And the research you'd be considered to be doing, have a look at See the Funky Areas, and then choose something that you think is aligned to your interests, so you can at least discuss it, and questions that might come up in the area that you think are novel. This is a really common question, asking about publications that have changed your clinical practice. Please have at least 3 to 5 papers that you can quote verbatim, that are recent, novel, and actually have read the papers so you know what it means and what the clinical ramification is. Also have a think about where your specialty is. Is your specialty in dermatology or rheumatology or imaging all going to be based on AI in the future, and you're going to be putting the clinical ramifications on the AI technology? Is it that you're going to become less invasive or more invasive? Is it that the medications are going to change? Is it that immune therapy is going to come in? How are things going to be different? And really preparing you for your future, but also trying to get an understanding of what you think the specialty holds in the future. I think we've already mentioned scenarios in the past, but if you can think about these three questions here, and how are you going to respond to these particular scenarios, again, to show your maturity, your leadership, your real, and please have examples that you've dealt with in the past, and spin it in a positive outcome of how it's worked out, or be real about how it's worked out in a negative situation and what you learn from it. I think that's very reasonable also. Occasionally, there are questions about clinical governance. What do you think about clinical governance? What do you understand about clinical governance, and how have you been involved with clinical governance? So have a think about committees that you might have been on to improve outcome, both with groups and patients and clinicians, and how you can strive to deliver safer, better outcomes and better service provision. Just have a bit of a talk with colleagues about this question and how you would answer it. It's very typical at the interview they ask if you have any questions, and I think most of you who ask questions should have actually asked these questions beforehand. A common question is when you'll find out the result. Similarly, is there research opportunities? Are there opportunities to be able to teach? You should have found that out beforehand. This is your opportunity to wrap up and give yourself a huge wrap in presenting yourself to this group of people. For instance, I just want to let you know that this hospital is my first preference, or this network is my first preference for these reasons, and I hope to contribute significantly into research or teaching whilst looking after the amazing patients that come to this network. And you're particularly motivated and hope that your application is seen as positive. Similarly, if there's something that you've not been able to address in the interview that you think is particularly important, a difficulty that you'd like to help with in the area, or a skill set that you haven't spoken about to date, which highlights why you'd be good in this particular area, it's good time to bring it forward. When you are practicing for your exams, for the interviews, make sure that you don't go in verbatim. It's meant to be a discussion. It's meant to be somewhat lighthearted. It's meant to be you showing that you're a motivated person that has great ideas of where you'd like to be in the future and how you can contribute. And so have the stories loose that you can discuss them rather than anything written down. And I wish you all good luck for the upcoming interviews.